Hello, I'm Peter Rabinowitz from the University of Washington, and I'm going to be talking about the One Health approach and perspectives it can provide about chronic pain, treatment, and recovery. One Health is a concept that has gotten a lot of attention in recent decades because it recognizes the connections between the health of people, the health of animals, and the health of the environments that we share. And this has come into sharp relief recently because of these emerging infectious diseases like MERS and SARS and bird flu. Most emerging infectious diseases are zoonotic, coming from animals. And so this has forced us to really think about what are these connections between our health and the health of animals and the environment that connects us. Antimicrobial resistance is another issue where antibiotics being used in humans and animals. And then food security, the way we're raising food, the types of animal farms, the types of habitat destruction we're doing to raise food, all related to the One Health concept. But in addition, as the environment changes from climate change and other environmental forces, animals are often the canary in the coal mine, telling us if they have disease events that there is something in the environment that may be a hazard for humans as well. And in general, One Health encourages us to take a species spanning approach to health, to say, what does health look like in other species, and what can that tell us about human health and the way we are treating it? So we talked about infectious diseases, but what can we learn from animals about chronic conditions such as cancer, depression, musculoskeletal injuries, and pain? Can we look across different species to find new ideas and perspectives to improve the way that we are treating and preventing disease and injury in humans? And this is a picture of a clinic that we've started, the One Health Clinic in Seattle, which provides integrated human health care and veterinary care to people who are experiencing homelessness who have animals. So we have them come to the clinic and they get a veterinary checkup for the animal and also a medical checkup for the human. And the veterinarians and the human healthcare providers then can share information about what's happening with the animal, what's happening with the human, and what could we learn from each of these that would help us take better care of sort of the human animal unit. And that's just an example of species spanning medicine. So I'm going to take you through a case example that's really related to rehabilitation and recovery. And this is a true case of a red-tailed hawk that is brought to a wildlife rehabilitation facility because it's been eating ducks and chickens in backyards. Usually a hawk like this is a high-functioning animal with incredible vision, incredible flight ability, coordination to be able to feed and evade danger on a daily basis. And so the fact that it was just sort of hanging around backyards means that something was wrong with how it was doing. And on exam, you can see a real swelling of the left foot and a missing talon of on one of the toes. So there's really something going on here. And as the animal was being acutely managed in the wildlife rehabilitation, there was immediate attention to the environment of the animal, the acute environment, how to make it as supportive as possible, how to reduce acute stress, because veterinarians know that that can actually kill animals called capture cardiomyopathy, where their heart can stop because of the amount of stress. And so have them in a darkened cage, soft bedding, but at the same time starting to work on diagnosis and treatment of the animal itself and its host factors. If there's an infection, starting antibiotics, which happened in this case, pain medication, eventual amputation, and realizing that the nutritional status of the animal is down and needs to really be improved as a major part of the recovery. And as the recovery proceeds, then the discussion is really, is this bird capable of going back to the wild where it's a life and death situation? They need to capture prey, avoid danger. And is there going to be a balance between the host factors and the host resilience and the demands of the environment? And what can be done before release to maximize that host resilience, like training exercises for strength and coordination, optimizing the nutrition, doing a gradual reintroduction to the environment? Even though you can't control the whole environment here, you can still get the bird as ready as possible for it. And in this case, it was successful. So compare that with how we're taking care of humans when they come in with acute injuries and then move toward chronic recovery and rehabilitation. Many times we first of all don't always recognize that they're coming to hospitalization or care in a clinic because something has failed in the balance between their host factors and their environment, that somehow they are not tolerating well the demands of the environment. And then acutely, when we're taking care of them, we put them in a very noisy and stressful environment, typically, where there's alarms going off and they have separation from their support system. There can be healthcare providers who are not totally thinking about the comfort of the patient. And as we know, pain in this situation can be either under or over treated. So what is the recovery process that then can go on? And one thing that we do in medical care is that we often focus our recovery process on only one body part or organ in really specialty oriented care. And we neglect some of these other host factors like nutrition, psychological factors, spiritual state, as we do our recovery. In addition, we often are sort of detached from the environment of the patient, and we're not aware of all the demands of the environment that the patient's going to be returning to. And we don't think about ways that we could actually modify that environment or in some way change some dynamics of the psychosocial and physical environment that could really make a difference. And so we miss that chance to do a holistic assessment of the host environment balance as we're trying to complete the recovery process. As a result, we have some missed opportunities. We may really fail to understand what could be done in the environment and take some of those steps as a healthcare team. And we also may miss some of the crucial host factors like depression, anxiety, PTSD, nutritional status, overall physical conditioning that are going to make a real difference in terms of reintegration into the environment. And this is again because we're just not thinking constantly of this balance or imbalance between host factors and the environment for the patient. So in general, a One Health approach can really remind us that we're animals as well, and the animals really could have something to teach us about chronic pain and recovery. They can really remind us about the delicate balance between host physical and psychosocial abilities and the demands of the environments where a patient has to function. They can help us pay more attention to the environment, understand it, find ways to make it less stressful, more nurturing physically and emotionally, and in general, to think broadly about fostering host resilience in that particular environment in order to restore a host environment balance. So I hope this One Health approach overview has been helpful for you in providing some perspective about the ongoing care that you provide for chronic pain and recovery. Thank you.